Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we are the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
How and when to use a TENS unit for pain relief, which is going to keep it simple, Brad. We're going to get right down to basics here.
It's a wonderful device, and it works great on chronic pain. And when it works for people, it really works well, I found. But Bob, there's people out there waiting. I
Thanks
see them
for
coming
coming.
in. It's a beautiful day out there.
Yeah, it is. Finally. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us because Brad and I, we just really need to be liked.
Yeah.
Can we just say it that way?
Yeah,
So-
yeah, and it's working, Bob. People are starting to like us more every day.
I found one yesterday that liked me. So,
TENS unit.
what is it?
What is TENS? TENS.
Yeah.
Transcutaneous.
It's an acronym. I'm sorry.
Acronym, no, it's transcutaneous electrical nerve stimulation.
I've also heard it called transcutaneous electrical neuromuscular stimulation.
Yeah.
So it's either way.
Right.
So
one way or another, it's a mouthful, so you just say
Right.
TENS.
Right.
And what does it do? So you got this acronym or this big title, and it's for managing pain. It's not going to eliminate pain, but it manages it.
It doesn't help it heal. I mean,
Right.
it's really like you said, chronic pain quite often, right?
Right.
Brad?
Oftentimes, for someone who has chronic pain, they're taking pain meds, they're having problems and side effects with the pain meds. This can eliminate taking the pain meds, and there's no side effects to this.
Right. It's really, I mean, with the exception of some precautions, it really is a great device to use if it works. Because again, I don't know. I mean, what percentage would you think works on your patients?
Well, I would say
What percentage?
probably about 50%.
That's what I would say. The same thing. It's about 50%. It just seems like some people really like it, and some people like it really didn't do anything for me.
And I think some
So-
people from TENS, they hear TENS, they don't think too much about it. Then they hear something about electricity. People can get a little nervous about that,
Right.
but you don't have to have any concerns. It's completely safe. The amount of amperage used for this is so small. They're complete. It's not going to do anything to you except for give you the sensation.
Well,
that it
having
needs.
said that, though, you want to start off slowly. I mean, because
Well-
you can zap yourself pretty good with it. I mean, if you
but
turn it way up.
it's not going to hurt you.
No.
You'll feel it, but
Right.
you can't get electrocuted. Let
Right,
me put it that
right,
way.
exactly.
It's safe that way. How does it work? So it's like, what are we doing? We're hooking up electrodes, some wires to us, and what it's doing is it's doing something called the gate theory, which we don't want to get into the whole details
Specifics
of
of it too much.
But it blocks the messages of pain from if this is the pain site right here on my elbow, it interferes or interrupts the pain message to your brain, so you don't feel it.
It cuts it right off.
Right.
So it stimulates a nerve that cuts it off. So
What I use an analogy is if you burn your finger and you put your finger under cold water, you don't feel the pain, you feel the cold water running over it.
right.
It's not exactly the same thing, but if you can think of it that way.
Kind of even when you rub, like when you're having, you hurt something and you start rubbing it.
Right.
I mean, that's the same thing. You're also kind of cutting off the pain you're flooding the pain nerves so that
Right.
they can't respond as well.
I think
So-
we've got people glazed over.
Yeah,
now
completely.
with
Yeah.
all that.
It works on 50% of the people. Let's just say that.
And the other thing is it does get some endorphins going. So when
Right.
you can't have this on all the time. I usually go for a maximum of 30 minutes, but afterwards you get some endorphin release, which can continue the pain relief after you turn it off.
My understanding, Brad, was that if you use like low tens, it's more endorphins, which again, people aren't going to understand that.
Right.
But if you use high tens, you can keep it on all day because it's the gate theory and it just keeps working. You know what I mean? If you're
Right, right.
It's depending on what you're trying to go for. So I
Right.
think you can leave it on longer times.
And
So-
well, then the other thing, and see, obviously there's
There's different schools
theories
of thought on
and
it, yeah.
controversies. If
Yeah.
you leave it on all the time, does your body acclimate
Adapt to it.
Right.
And sometimes it does, and then we say turn it up more.
Sure.
So,
or change the channel, which we'll get into,
Right.
or the frequency.
Okay.
So people are really going to be wondering about this.
Yeah.
When we get to the use of it, they're really not real hard to use. So who can use it? Like this, we're going through the I Relieve.
I Relieve. This was we just looked online and found one that had really good reviews. It was a decent price, a very good price, I
Right.
thought, compared to what they used to be.
So yeah, we start using it. It's a nice unit.
Yeah.
I would say it's easier than a lot of them I've used as far as setup and how to use it. But they recommend nobody under 16. For elderly people or whoever may be using it, they need to be alert, be able to comprehend and use it well.
And educated on it.
Right,
Yeah.
be educated, and you should get an order, have a doctor or a therapist say this is for you.
Right. And we're saying even maybe if your therapist already said, a TENS unit would work for you, maybe they'd show it to you, and this is a good review for you.
Right, because it does take a little bit of practice to get used to all the ins and outs. I know when I have a patient and I spend a whole period with them showing exactly how to use it. I show them how to use it. I put it in their hands. I say, can you use it all by yourself? And when they can do that, then they can walk out the door.
Exactly.
So there are some people who will not and cannot use it under certain health conditions. One is if you have a pacemaker.
Right.
You're not going to have it if you have a pacemaker. If you have any metal implants.
You don't put it over the metal implants. You can use it, just don't use it over the metal
Right.
implant.
So if you got a new knee, you're not going to use it over your knee. And then also,
if you're pregnant,
you're not going to use it on water. You're not going to use it around a wound. Open wound.
Right, and I think what you said, Brad, really don't use it from the neck up. I mean, you don't want to use it on the carotid arteries. You don't want to use it on the temples. You don't want to use it over your eyes. I mean, so really,
I've never done anything.
From the neck.
Right, from here down.
You could go in the back. Of
right,
the neck.
lower neck, sure.
Yeah. So.
Okay, so how do you use it? So, here it is. I put it in my pocket.
All right.
And which is a nice place to put it. And they have a belt.
It's got a clip on,
too. So you can put on your belt. That is one of the disadvantages of you have some wires that you have to, and the little unit. This is small.
If the wires go into your back, though, you never see them. If you're covered up by your shirt.
You have to manage them, though, and figure out where you're going to do it. But once you get used to that, it's no big deal. Now, in this case, I just picked my arm because it was easy to demonstrate. But you can use this on any part of your body. You can knee pain, back pain, chest pain, wherever you have the spot. If the pain is really drawn out, let's say I had pain from my neck all the way down to my hand, that gets kind of hard to manage with a TENS. But if it's a smaller area, it works a little easier.
I don't know if I would do chest pain, though, either, Brad. I have that checked out if you're having chest pain.
That's a good point.
Yeah.
Okay, so this red area represents where my pain is. Let's say I've got some tennis elbow and it's running down here.
Sure.
I'm going to put a pad. If I'm just going to use one channel, there's 2 channels on here. Each channel is 2 pads.
Sure.
You have to have 2 pads to make the unit work. So I'm going to put one pad on this side of the pain and one pad on this side. I could put it here and here or here and here, but I want to cross the pain area. And then you do need to spend some time with the book because there's a lot of little things to remember, like on this one, but once you get it, it's quite easy. So it says there's just, I don't know, can you see this, Lonnie? Is that pretty clear? A little closer? Okay, so there's an on button.
That's on button.
It turns it on. Here's one channel. On this channel, I have one channel I'm only using. And I'm going to go to mode. On this particular unit, there's 8 modes. There we go. Now, first I'm going to set the time. This asks you to set the time. It goes 5, 10, 20, 30, all the way up to an hour. Okay. I'm just going to leave it at 5 minutes. I'm going to hit mode again. Then it blinks over here under P. I don't know why the P is program, I believe, or mode. This is on 5. There's 8 different modes on here. If you look in the book, they tell you what each mode is recommended for, like back pain, elbow pain, neck pain. But I found that you can use whatever mode works good for you in any location.
Yeah, you can experiment, and I would definitely do that because you'll find something works better than others.
I went through this sitting on my couch the other night. I went through every mode for 5 minutes just to see what they feel like, and plus you get used to the unit that way.
Right.
So that works out well. So I'm just going to go to channel 1. I'm going to push that. That's blinking, and now I can go. There's a plus and a minus. The on has a plus below it. Off has a minus below it. So now we're going to go off the plus, which means
you're increasing the intensity.
Right. I'm at 3, 4. I start to feel a little tingles, pins and needles.
Sure.
Now I have some people you can go way up before they start to feel it, and I've had other people that
almost
I just
immediately
hit 1, 2, or 3. And it's like, oh, I really feel it. So everyone feels
way different.
Yep, responds differently.
I've had people where I thought the unit didn't work. I pushed it up, so then I put it on myself, and I'm like,
oh yeah, it's jumping.
Yeah.
So I'm at 8 right now, and I can
now
feel
you
it.
can start to see it pulse a little bit.
Right. Now, if I go high enough, it's normal, particularly where you put the pads. I'll go a little higher. You can see it's starting to make my muscles contract.
Right.
Little neuromuscular
It's kind
there.
of a wild feeling.
Right. And there we go.
There it is.
I'll go a little more.
It's moving on its own there.
Now, see, this finger's
Yeah.
contracting all by itself. So,
He's not doing that.
right,
I mean,
I'm
the
going to
unit's
pull it
doing that.
back. Now, this is too high because I cannot function.
Sure.
Because it's making my muscles contract, or I have to move the electrodes. I'm going to go back down. That's at 11, and we're going to go down. And I believe this goes up to 30. I've never gone as high as it could go. I have to look in the instructions. I did not do that because it's not important at this point in time. But now, if you have more pain or you want to manage this even more aggressively, you put 4 pads on, okay?
And you can, by the way, I remember what they recommend, but they don't want the pads too close together either.
Right.
I
yeah.
don't remember. It's a couple inches or an inch at least that you
Right.
have apart.
Yeah, if you put them right next to each other, it's too close. You
Yeah.
got to have some distance.
Yeah.
Now I've got the other pads set up here. Bob, you want to hold
Sure.
on to that for a second? You
He's got a lot of trust here in me, doesn't
here.
he?
Yeah, go ahead, plug that in.
So that was channel 1. Now this is going into channel 2, this lead.
And so now I'm going to surround it and make sure you put the pads so they make a crisscross.
Sure.
So this is one channel, this lead and this lead is one channel. You wouldn't want to put the same channel here, here, and here, and here, because the current's just going to go directly across from there to there. You want to crisscross them so the current goes this way and then crosses this way, so it makes an X.
You may want to clean the skin
Yep.
before you do this.
Right.
And if you have a lot of hair, you may want to shave it.
Yep, it'll give you better contact, plus the pads last longer.
Right.
Because you got to take these on and off, and the cleaner they are and the less hair you have, the longer they last when they wear out and they don't stick anymore.
Comes with 8 pads, so which is pretty decent. You know, Brad and I are old enough that we remember when TENS units cost like $1,000, or I mean, they were like $1,500.
Right.
And now for $39.95, you can get one of these units. It just blows my mind, to be honest with you.
Okay, so we got both pads. I'm going on channel 1. I'm going to just bring that up to 9. Now I'm going to hit channel 2, and then the channel 2 number is blinking away. So, and I'm going to go up on channel 2. Whoa, whoa. Now I'm at 4 there, and I've got all the intensity that I want.
Are you feeling channel 1 also right now?
Well, right now I feel it kind of all over the place.
Okay, so it's hard to tell.
Right, which is a good thing. Now I wouldn't want to go any higher because I can feel my muscles start to be innervated, and I can still control them though. I'm thinking I'm going to go back to channel 1 and go down just a little. There, that's better.
And you can experiment on the placement of the pads too.
Right.
I mean, like they talk about, if you do have pain going down the arm, sometimes they do recommend going on the nerve path.
Right.
Putting one along
Right.
there. So
If you had a long, long pain pattern, you might put one here and one here, one channel, and then another channel down here.
Yep.
Then you got to, this is the thing, you got to get the wires managed or tucked in properly. So with this, I would probably run them up through my sleeve, down into here, and then I would tuck this in my pocket or put
You
it on my
can wear
belt.
a long sleeve.
Sure.
I mean,
Yep.
right.
So that is just something you have to manage. But if it takes care of the pain, you don't have to take pain pills. It's going to be well worth it.
A big putt.
Right.
So
very good, Bob. I really think that this is going to be help a lot of people with pain. But there's one thing that, again, we're working on. It's not going to help cure that.
I don't remember what it is.
The broken heart.
Oh yeah, that's
Bob.
right.
Yeah.
We can fix just about anything except for a broken heart.
This isn't going to help for that, Bob. I don't think.
All right, thanks for watching.